participate in G20 for Indonesia. Thank you. The time is yours.
Thank you very much.
You're
Thank
welcome.
you. Good afternoon, everyone. Selamat sore.
Selamat sore.
All right. All right. So we start with an introduction.
Yeah, no, it's possible.
All right. So we really appreciate the invitation by Indonesia's health minister. GISAID has this very, very long relationship that dates back to 2006 with Indonesia when you were first confronted with flu burung, the H5N1 Karo case in Sumatra. And, you know, it was a journey to find a way that adds transparency to the exchange of information. The fact that I'm actually here surrounded by friends and former colleagues. I used to come from the media business, as some of you may know. I was with Time Warner. We had a big publishing division as well, besides broadcasting, television, music, and motion picture. And one of the things that you will appreciate is as you hear and you're writing and you're filing your stories, is that you're creating something that is yours for that very moment, that you're ready to share eventually when your story is ready and you're filing your story with your editors. I kind of discovered in 2006, rather by happenstance, that when researchers generate information, which is not easy, it does not fall out of the sky, they actually have to work on that, sometimes very late at night, particularly during a pandemic like right now, that they were expected to give their story, to give whatever they put together out there in the world, in a public domain, kind of an anonymous way. And this permitted others to basically plagiarize, you know, to take that story, make it their own, put their name on it. And there was very little incentive. It's sort of like you writing the story right now, and then you find out before you get to file that story in print, somebody puts their name on your story and makes money with it, and you're like standing there, you don't understand the world anymore. So this is how I think I got involved, and then GISAID was confronted by saying we have to change this. Yeah, we had to change it. And it took us, you know, in discussing with your government in 2006 and many other governments, particularly the United States government, we worked for a year and a half, and we said there must be a way that we can incentivize the sharing of the story where you are always acknowledged that your rights as a generator of information will not be taken away from you. And this journey basically took us all the way till May 2008, when GISAID went live during the World Health Assembly. So it's now 14 years. And yeah, time flies. Yeah. My hair color was different. I probably had less bags under my eyes. But, you know, the journey's been a very interesting one. The journey has been so interesting because for 12 years with influenza, whenever there was an outbreak, people shared the data very fast. They did it transparently. And there was always this level of, you know, if I don't do right with the person that's writing the story, that's generating the data, I may not have access anymore. So everybody played by the rules. Then comes the pandemic. For us in GISAID, that was, you know, the early days. 8th, I received a text message, January 8, 2020. On the 9th, I received an email with the first genomes attached, the whole genome that we processed, my team, and then we shared it through GISAID with the world, which is how you got your vaccines, your mRNA was developed on that, how the first diagnostic test. So this was a very important thing. Now, looking back, it was an important event. And 2.5 years into this, we have noticed that countries that have never even generated genomic data, they are now participating. All of the countries in South America, Central America, 54 out of 55 countries in Africa, all of Southeast Asia, with the exception of North Korea, because they didn't have cases, if you remember, right? Well, they said they don't have any cases, right? So we're waiting for those, and I hope for the people of North Korea that things are not so bad as we assume. But we are here now because it's an historic opportunity right now for the country where GISAID originated, Indonesia, to have this presidency over the G20. I just find this really an extremely, you know, there's something out there that says Indonesia is going to call the shots this year, right? And you are. You have a very convincing government with your president, particularly also with your health minister, who's very keen to make a difference during that 1 year of the G20. And we can see that it's very difficult to maneuver through the political landscape. It's not easy, but there's a certain skill that Indonesians have that is in part hospitality, but that's also tenacity, not to give up and to look forward. So I think we're here right now to, as just closing my opening remark here, that when I speak to my colleagues that I see from around the world that have attended G20 summits, they're blown away with your performance, you know, particularly on the public health side. So it's an extremely great start. So.
Okay. Thank you very much, Mr. Peter Bruckner. How to convince the leaders, how to convince the president, how to convince the world to be concerned to the GISAID or the data of the systems like this in the world. Thank you, Bruckner. And teman-teman, jika ada pertanyaan terkait dengan GISAID perannya di kancah dunia saat ini dan sedang diprakarsai dalam pertemuan G20 pada saat ini, silahkan kami persilahkan untuk bertanya kepada Peter Bruckner. Oke, silakan Pak.
Terima kasih, saya Andi dari kantor Berita Antara. OIG said only facilitates the influenza virus reporting, and how does GISAID respond to the GISAID Plus concept? Thank you.
So if I understand your first question correctly, why did we only do influenza all these years? Yeah. I have to be honest with you, we kept it to influenza, not because there was no need for other pathogens, but I think because some of us in GISAID early on noticed there was concern by those that believe they should be in charge of data sharing. There's a world that believes they're entitled to do something, you know, bureaucrats or funding organizations. And we noticed in 2014 when the White House asked us, this is the Obama administration, to assist Africa with the Ebola outbreak, to share data, that despite the power of the US government, despite even a German government supporting that, and despite us willing to help with Ebola, that we discovered there were politics involved in Geneva possibly, that kept GISAID away from the table to the point where, you know, you feel like if they don't want you, then you're not going to offer. This happened to us exactly 1 year later with the MERS coronavirus outbreak. If you remember, the camels passed on the coronavirus to humans. It's a very, very pathogenic virus. Something similar went on that year. And then following 2016, when Brazil asked us, can you help us with the Zika virus? You know, then we got cold feet and saying, you know what, we don't want to be in trouble to some people and doing other pathogens, because there are organizations that say we are responsible for the sharing of genomes, you know. And so prior to GISAID, these platforms existed, but nobody wants to use them because there's no transparency. So that would be the answer to your question, why were we reluctant and why did we change this in 2020? You know, I think it's probably a good friend from China who called a scientist who convinced us there's only very few cases. And we believed him that there's very few cases in Wuhan. Of course, it's not very few cases. It's many, many millions of cases. But that's the question, number one. Number two was GISAID Plus. Yeah. So knowing this background that we had previously and making a change in 2020, we added, in addition to influenza, the coronavirus, the SARS-CoV-2. And we also realized the acceptance around the world. And then the requests came in. Can you do Zika? Can you do dengue? Can you do other pathogens? We experimented last year. We added a virus known as RSV that affects newborn children, particularly in low to middle income countries, just to open the door to see, can we do it? You know, what happens if we do this? Do we have the capacity? And so that went well. And recently, as you may have heard, we are also assisting now with the monkeypox virus sharing, because that is a big question mark. They don't yet know and understand really well, how this spilled over into a human-to-human scenario, why it was a particular group that it affected. So we've been doing this. And I think it was Indonesia who actually came up with this idea, GISAID Plus. This does not come from us, but we're open to it. We're open to it because we believe it's working so well, that system of sharing, that we cannot just say we don't want to. Because GISAID isn't about one individual saying yes or no, it's really a community that shares. So I think you will see that this year there's a family of viruses known as ARBO, the flaviviruses, to which belongs Zika, dengue, chikungunya, West Nile. We will assist with that. I think we also will probably make a statement related to TB, not here today, but I think you will see something also coming in that direction. So just to put this in a nutshell, GISAID Plus for us is priority pathogens that have a high impact. Yeah? There are in the neighborhood of 300,000 species that you can have a genome from. GISAID doesn't want to and shouldn't be used for that purpose. But for an unknown disease like disease X, or pathogens that really have a major impact, epidemic or even pandemic potential, GISAID should be considered as a way, as an option to share. People always have a choice how they share, including not to share. Yeah? And that's happening. It's happening. If you look at TB, there's institutes and universities that have TB data. They don't share. There's no global sharing. And when you look at GISAID and SARS-CoV-2, you have 50,000 researchers participating, 50K, 50,000 researchers, and you've got 11.5 million cases, genomes, 11.5 million. So this is, it's a very, very different, and I think we learn from this what's possible. And given that we have technology that all of you hold in your hands, you will see that the generating of data will become easier and easier. And it's like a democratization of genomic surveillance. We will understand much better what is going on. So it's a great opportunity, actually, GISAID Plus.
Peter, thank you very much. Jadi teman-teman, bagaimana dunia ini disatukan dengan kesepakatan untuk menggunakan GISAID ini. Saat ini pandemi tentu bukan hanya akhir hari ini, tapi kesadaran dari para negara untuk bisa menggunakan GISAID ini. How to unite the world, how to unite the data in the world as based now situation about the pandemic in the world. Thank you. Ada pertanyaan lagi dari teman-teman, silahkan Pak Hendy. Okay. FP. Yuri. Okay, enough maybe. Okay, the closing statement from you about the GISAID.
Oh,
yeah,
statement.
Yeah,
okay. Yeah. Well, so we believe that GISAID is born from a desire for transparency. We believe transparency will prevail. I think just by their mere nature, you talked about just a moment ago, countries sharing with one another. What we need to do is share globally. That's really what we need to do. Yeah, so we can connect on Omicron that was first actually caught in Hong Kong before caught in Botswana and South Africa. So that's global sharing. So I think the cards are on the table. We are very convinced that this model of GISAID is the future model for all high priority pathogens. I'm just very convinced about that.
Thank you, Pak Peter, for your information for us, and it is a nice time to share about the information, especially in GISAID mechanism in the world. Thank you. Selamat sore dan terima kasih.